prepared for this evening's section. And on behalf of the entire team of volunteers, the president and the executives, we say thank you and we welcome you on board for today's event. So, hello, sir. You're welcome here, sir.
All right, thank you very much. All right, can I go ahead?
Yes, sir. You're welcome, sir.
All right. First of all, I would like to welcome everyone to this important gathering, which has to do with the HSP NEEDCOM Volunteers Post-Traumatic Therapy Program, in which we intend today to go through, or maybe we want to get a way of having post-traumatic rehabilitation program, which is targeted at Nigerian returnees due to Russian-Ukrainian war. And today being Thursday, 21st April, 2022. I want us to, or I'm going to be talking about suicide as a problem of today's youth and a setback to national development solutions and then the way forward. I know some of us might be thinking about why the choice of this topic, but I think this topic is apt because, you know, most of the things that happen in our country that are not known to other people is because such people are not aware of certain because it has not happened in their own end or it has not happened to them. So I think this issue of suicide is one of the, I can say, problems that is facing our country, especially youth and especially students in tertiary institutions. And I know most of the returnees that came back from Russia, from Ukraine, due to the problem of the Russian-Ukrainian war, mostly are students. And of course, you know, when somebody has gone for, you know, a life task that somebody wants to get knowledge, and then at the end of the day, for the person to be beneficial to himself, family, and the country, at the end of the day, shutting down or maybe having problem with that might bring some tendencies of this. So under my synopsis, we're going to be discussing some definitions, and these definitions will be about what is suicide, and then for us to also look into what we call depression, and then for us to get through the statistics on suicide and depression, and then be discussing on the factors triggering suicide, stroke depression, and also the impacts of suicide, and also at the same time, prevention of suicide. And then we have closing remarks as well as some acknowledgements. So first of all, I would like to start with the suicide. Suicide, of course, whenever we go through definitions, we know that we have so many schools of thought about definitions. But since we are discussing here not in terms of technicality of what suicide is talking about, we can easily just define suicide as the act of deliberately killing oneself. And of course, this suicide has some risk factors. And these risk factors include mental disorders, especially depression. And you also have some neurological disorders, as well as sometimes you have some cancer and HIV infection, meaning that cancer and HIV infection complications can also bring about some issues because sometimes people feel some kind of problems. Why are they having cancer? Why are they neglected? Why are they HIV infected, and so on and so forth? This suicide that we're talking about has a lot of connotation because every year, almost about 1 million people commit suicide or die from suicide, which about 86% of them are in low or middle income countries. I know in so many countries, we normally have problems, especially developed countries. Suicide has whatever, but 86% of those that go for this suicide are in low and middle income countries. And I do believe, you believe with me that Nigeria is one of them. And suicide is among the 3 leading causes of death for young people under 25 years of age. And it accounts for about 10 to 20% of death in women up to 1 year after giving birth, because some women also have these tendencies of committing suicide. The median suicide rate for the countries of the Eastern Mediterranean region is about 4.9% per 100,000 people, compared to 6.55 for all countries of the world. So meaning the Mediterranean countries have less when you compare to other countries that have 6.55 in 100,000. And also this suicide is one of the priority conditions identified as part of what the World Health Organization Mental Health Gap Action Program, meaning when WHO came to realize that there are some, of course, they normally have some roll-down programs that they normally have in order to solve some problems. So who came up with what we call WHO Mental Health Gap Action Program? And this program has been given much priority by WHO because of the problem associated with it. And the regional strategy that is recommended or recommends for development of a recording and reporting system, because one of the problems that which is common to many of the mental problems or psychiatric problems or psychiatric related or mental problems is the fact that they are underreported and also they are underrecorded. So there should be a way. This program tends or intends to get a way of having it to be reported and also having it to be recorded, because in many countries such things happen, but since they are not investigated, they are not reported, or they are not recorded, so at the end of the day, we think that they do not happen, but they do. And also at the same time, this program brings about early recognition and management of mental, neurological, and substance abuse disorders in primary care, and also special programs for vulnerable populations such as adolescents, older people, and women, in order to reduce the means of committing suicide. What this program is talking about is the fact that suicide and many of such issues associated with it are underreported. So since they are underreported, then WHO came up with a program that will enhance the development of reporting them. The more we report them, the more we get them, the more we record them, the more it gives us the understanding that they do happen. So let's just digress a bit to go into what we call depression, because suicide does not just happen one day. There must be something that will trigger it. So one of such big things that trigger it is what we call depression. Depression, simply put, can be made to be defined as common neuropsychiatric disorder, which is characterized by, meaning it's a disorder whereby that it affects the nervous system. It's a disorder, and it brings about, affecting the mental balance of human beings. That's why we call it neuropsychiatric. It is characterized by change in mood. The people that have depression normally get to have, what we call mood swing. They also have what we call lack of interest in measurable or in pleasurable activities. Some of the activities that they normally do at normal time, meaning normally they do them, at the end of the day, they lose interest, which what we call anhedonia. And then some of them go into what we call weight gain. And then they start to have some sleeping problems, which is insomnia. They also start to have fatigue. They also start to have the feeling of worthlessness. They feel that they are not worth. They also tend to have less concentration, difficulty in concentration. If they are students, of course, most of this that we talk about, or workers, at the end of the day, they lose concentration. And then that will get to almost the terminal end of it, which will now be the suicide tendencies or the thought for suicide. At that time, you see, individuals with this depression may experience 5 or more of these symptoms. So if you check these symptoms that we have, about 10 of them, at least we normally address, or we normally categorize somebody as having depression when at least 5 of such symptoms are a kind of seen or have been a kind of recorded in that individual, and that lasts for more than 2 weeks. So it is suspected that when somebody has, mood swing can take, especially for women, for instance, Women during menstrual period, they can have mood swing and everything. So you cannot just say that they're depressed. What we are talking about, these symptoms that we have characterized, at least 5 of them that will last for about more than 2 weeks. It is expected at that time we can say the person is a kind of depressed. Such people also may also feel overwhelmed by the problems. These problems might be real or imagined. Most depression that do happen, sometimes the people, when you interact with them, you come to realize that some of the problems are real, while some are just imagined by those people. And then that they feel they cannot confront the problem. And so they begin to imagine that they want to, or they have become the burden of their, or they have become burden to their families. They have become burden to their society. They are worthless and so on and so forth. So at that time, these are some of the things that they feel. It is with this background of these types of thoughts that at the end of the day, such people feel that death is the end, or death is a better, a kind of a situation that they can let them just end their life. When they end their life, then that feeling of worthlessness, that issue of having or being feeling that they are burden to their families will go. With this, we'll now move on to understand if these are the feelings that people feel at the level of depression, which at the end of the day might take them to the suicide tendencies. So let's see, this suicide that we're talking about, how much does it happen? WHO estimates that about 1 million suicide death occurs every year. 1 million, meaning 1 million suicide death occurs every year. Every year, it is expected that 1 million people will die of suicide. But of course, this transcends to be more because, as I've said earlier, many people do not record it, many people do not report it. So at the end of the day, it downplays the statistics. This translates to what we call at least one suicide death every 40 seconds, meaning at each and every 40 seconds, less than a minute, somebody will die out of suicide. So how can we prevent this avoidable loss of precious human lives? How do we do that? How do we do that? For us to do that, this number is struggling, meaning that this number is too much. When we appreciate that there are several regions of the world, such as Nigeria, of course, in the world, Nigeria is part of Africa, and then definitely there are so many developing countries which do not have accurate death records and a reporting system. So it means that we should expect to have more of this, what we're talking about. So even when we take 1 million suicide every year, then we can now say it is too much. Or we say every 40 seconds you have somebody dying out of suicide, then it's much. So when you compare to countries like Nigeria, where we don't have a reporting system, then it means that it's something that we need to be talking about, and we need to be having awareness about it. And in the time it has taken for you to read this article, meaning as we have started this lecture now, I think almost we have gotten into almost about 10 minutes or more. So it means that more than 10 people have died, because of suicide. So the number of attempted suicides annually is about 20 times the number of completed suicides. These statistics that we're talking about, we said every 40 seconds, at least you have one death from suicide. Then the tendencies, attempted, people that have attempted to, commit suicide, perhaps they have been prevented by family members or by some other issues or reasons, that accounts for 20 times what we have. It means, when you say that, it means about more than 20 million, getting to about 25 million, because when we say every 40 seconds, and at the end of the day, when you say 20 times, it means that, you have more than 20 million, attempted suicides a year. Let us also see what are the factors that trigger suicide. There are several factors, some of them that predispose people to suicide. But what is consistent in that is that, one, most of the people that have these suicide tendencies or commit suicide experience intense and overwhelming emotional pain. And when you talk about emotional pain, it's much more than the physical pain that people go through. So they simply feel that they cannot cope. So if they feel that they cannot cope, then the commonest, of course, this is, if you remember, that's why I had to discuss depression. So the people that have these tendencies are more or less depressed. So if they are depressed, then at the end of the day, you now see that they can commit suicide. Of course, we have talked about it. This suicide is a mental disorder or mental health disorder, which occurs when certain levels of chemicals that we call the neurotransmitters in the brain are very low. So by the time somebody is going through such problems, at the end of the day, brain which coordinates and does all it does in terms of protecting and communicating with the whole body. At that time, these neurotransmitters get to their low level. And some of the problems that can be, or some of the negative effects that can make people to go into that depression and then going into suicide include job or financial losses. You see, when some people lose their job, death of loved ones, you have also shame and public loss of dignity. You also have loneliness, you have impulsiveness, and you have access to means, meaning that when people have less access to what they used to get. If you look into this, first of all, look into the job or financial losses. We can also, it's not job or whatever, also the issue of problem of study. When somebody feel that the study I'm going through, it's now been interrupted, like our young brothers and sisters, sons and daughters that have now been caught up in this kind of problem, then definitely. Or perhaps some of them might have even lost their friends, or some of their friends in the school. Perhaps the war that started might have caught up with someone, and at the end of the day, when somebody died, then the person whatever. Or some of them will feel ashamed that they are coming back to the country while they have all been told, or they have told people, or people know that they have traveled to study. At the end of the day, now they are back. And when they come back, they tend to make themselves to be lonely because they don't want to even associate with people. And then at the end of the day, a lot of problems will will come in. It is also noted that males are also at greater risk of committing suicide than females, which is also 3 times than what females can do. And also, we know that this mental illness brings about chronic physical illness, whereby in some instances, some people will now start to go into issues of drug abuse. I remember that from the beginning, we discussed about some of the things that people can do to cope, include perhaps maybe using drugs. Some people will now start to lose sleep insomnia. So if they lose that, then they start to take some drugs. If they take drugs or alcohol, at the end of the day, then that will bring about emotional distress, which will now bring about more risks of committing suicide. This suicide has a lot of impacts. What are these impacts? Suicide has devastating impacts on surviving family members, of course, friends and colleagues, and also the country at large. Victims of suicide usually undergo a lot of emotional turmoil with feelings of guilt. They feel that they are guilty, that they are the ones that caused themselves the problem. And also, they also feel betrayal. They also feel regret and feelings of inadequacy, with thoughts such as, if only I had been a more observant or caring or prayerful or dutiful parent or spouse or friend or colleague, perhaps this would not have happened. So for instance, some of them would now feel that, if I had been admitted in a Nigerian university, perhaps I wouldn't have been in Ukraine to have this problem of coming back now that I'm now having something like a shame. So something like that. So thus, in addition to the grief of mourning their loved ones, if it has to, after having this suicide, they also have to cope with the feelings of regret and inadequacies. So by the time somebody commits suicide, the family members also go through this problematic thoughts of having that. If we had gone to the room earlier, maybe he wouldn't have committed the suicide. If we had done something, we wouldn't have been in this mess. And also they feel that the misery of the people that have lost people is often worsened by the stigma and shame of being ridiculed as the family member of someone who committed suicide. We know that especially when you talk of Nigerians, where we have people with attachment to religion. We know in all religions, it is not expected for somebody to commit suicide. People might be making jest of the family that have had a member that have committed suicide. So at the end of the day, when such happens, the family is also thrown into a lot of grief. Those sorts of insinuations are not helpful and at all, and should be actively discouraged. So that's why when we come to some of the issues, awareness onto people on the prevention or maybe issues that can be done to help in terms of suicide, they include this. People need to realize that it can happen to any family. So if it can happen to any family, then what can we do in terms of supporting the family that have a member that has committed suicide? So how do you prevent suicide? I have divided this into about 3 categories. One, as individuals, what do we do? As an individual, what do I do? What do I do to avoid suicide? At that level, we should recognize the signs and suspect the individuals, or for us to understand that the individual is at risk. Meaning, by the time, as an individual myself, or as an individual looking at somebody, let's say as a parent or as a friend to somebody, there should be things that I should be looking at so that I will not allow my friend or my son or my daughter or my family member or a classmate go into suicide tendency because they show some kind of signs before they commit the suicide. Remember? So based on that, do not dismiss your suspicion. So by the time you see some things in an individual, a friend or anything, that that person is going into such tendency that I told you before when we talked about the issue of depression, the issue of the person has started to lose interest. You have a friend and then the friend has, stopped coming to class, or maybe you're back here in Nigeria, the person has started to call, this, whatever. So don't dismiss that your suspicion. Try to talk to family members and caregivers so that they will start to look, where is this person? Do not leave them alone, but ensure someone is with them. So by the time you have started seeing changes, your son, mostly of those now that came back now, you have started seeing your child now being lonely. The child is not showing interest. It's not coming for breakfast with the family. Maybe you have been, taking breakfast or lunch or any kind of meal together. The person is not coming. So try to check. Don't kind of whatever. So don't dismiss your suspicion and try to make sure that some people are with that person. Let them know you are concerned. Show them love. Try to be talking to them that, oh, sorry, you are not the one that caused this, this war will go after that, you're going back to school, better things are coming your own way, and so on and so forth, So do not show alarm or exhibit judgmental behavior. Don't look at them and start telling them, why are you? Are you not God-fearing? You are not going to take this, as a sort of, God's own doing, Don't do that. Try to show them love. Try to talk to them in a better way. Ask specific questions, find out if they are actively planning to do something. By the time you engage them, perhaps that might give you a clue of what they are trying to do. Presence of specific planning is an indication of serious intent. So when you start to hear them, they are saying, my life don't go finish. I don't like that. At the end of the day, you start to feel that these people might be planning something. So even if you cannot do to ensure they get professional evaluation from a qualified mental health professional, whether the person is psychiatrist or a clinical psychologist. That can help. This will help them navigate the maze of emotional problems or pain they go through. So this is very, very important. Then as a community, we need to have, or public, we need to have mass awareness. There should be mass awareness in making it possible to educate people in terms of, or to understand what suicide is talking about and other mental health challenges. That's why we normally say that people should learn either at workplace, either at school levels, either at market and anywhere, even at family level. Let's try to make mental health tips, mental health, a kind of awareness to be what we should learn. There are simple tips that we can, whatever, so that we can understand how our brains or how our brains work, how we can now get to make them optimum. It is an error to imagine that it is only people who are mad that need to see mental health, professionals. Sometimes when you tell somebody to see a psychiatrist, or maybe a psychologist, or maybe a neuroscientist or something, people will feel, I'm not mad. But people don't understand that it is not all like that. Psychiatrists are not only for mad people. They are there to look into your emotional problems, which might lead into such problems. Then as media has a lot to do in terms of contributing to a kind of preventing suicide. So media, what they need to do, the trend of social media to chronicle and discuss all the details of their last post, the struggle or something like that. Look into the social media handles of such people. Perhaps they might be discussing, what they are discussing can easily give you an idea of what they want to commit. While it is necessary important, important news, such as sad occurrences also provide an important avenue to provide education about risk factors. So media, whether radio, TV, and many of them, should get a way of engaging people with mental health professionality in order to be talking, radios, TVs, organizations like ASSP, please. We should get a way of trying to have pamphlets and everything that we now be sharing to people to make this awareness. I think what we should even be doing, I want to advise that ASP should bring out or should now establish or bring out a small committee that will be a kind of engaging, into the awareness on this kind of issues that have to do with mental health. It is very important. There's also emphasis should be on the fact that individuals who are depressed can recover and turn things around in their lifetime. All this can be done in media. When you, just like for instance, let's take example with HIV/AIDS. When HIV/AIDS came in, many people were having stigma, but by the time much awareness was given onto the fact that no, it is not a kind of very much bad if you have HIV/AIDS. There are ways that you can take care of yourself, this and that. At the end of the day, it has started becoming good now. People with HIV/AIDS now can easily come out and say that we are HIV/AIDS. And then because of the awareness, people have started knowing that they can even marry themselves, or even if they are married, that they can take care of themselves without, making the HIV to now be contracted by their spouse and also the family members. So I think a lot of things need to be done by media. Another thing is at the level of school, university, schools, and everything. Because I want to tell you on this why I had to include this is because of the fact that in 2019, I could remember around September, I delivered a lecture around, something like this in my university, that is Ahmadu Bello University, to students, union, government. They had like a week that they normally do, which is general for all the students. So at that time, I was made to talk. And then it became so apparently that at that time, some students in the university had decided or had the tendencies of committing suicide. In fact, some of them were prevented from committing suicide, I think about 4 of them. And that has to do with the fact that something happened in the university whereby some problems happened between the university and and the professional body of the students, of the course they are undergoing. Those students were nursing students. And there was a problem one time when the students were made to understand that they were not going to write their professional exam because their accreditation was withheld by nursing council. So at that time, some of them that are in final year, they came to realize that, perhaps they might be losing their whatever, that the course might be, closed or something like that due to lack of accreditation. So some of them wanted to commit suicide. If not that, there was proactive kind of way of making them to prevent them. At the end of the day, they should have that. So that's why I have included this. So that's why you should allow all students and staff to freely flourish. Those that are academics, maybe lecturers that are bullying students, universities, or even if it's at workplace, those bosses or those that boss their way onto people, they should be recognized, and the organization should make sure that they do not bully people, so that at the end of the day, other people that they are working on, or maybe they are bullying, might not go to commit suicide. There should also be issue of learning to develop regardless of their individual temperaments and dispositions, meaning people should learn to see that they can, they can flourish in their own way, not that they whatever. So bullying, taunting, and public humiliations can be devastating for some people. Some people can easily say that they want to commit suicide, maybe because they have been to class and then maybe the lecturer has, maybe sent them, even if you don't want somebody to come to your lecture or maybe to your class because the person is late, there's a way. They normally say that there are many better ways to help somebody to hell, and the person will be willing to take the trip rather than scolding the person and having some problems. Also, it is expected that they are assigned onto positions, whether they are academic heads or at workplaces of authority, those people that understand management. It is expected. Not everybody can be a head of an institution or a head of department or a head of a faculty or a head of department in a workplace. That person should be, before you assign, I want to advise that should go into public, I can say, maybe is it public service rules and everything, that such people, anybody that want to head, particular organization, anybody that want to head, human resource should be able to learn the art of management, both human and capital resources. How do you manage them? Not just for you to be given a position like that. Then there should be reward for reward on hard work, on the people that have done well, so that they can be supported. And then also we have what we call social support network, which is a network that should be made by having friendly and caring neighbors, religious support groups, like the one I'm talking about, like ASP is an organization. You try to have, social support network that will help in mass awareness, in being a good caregiver, and so on and so forth. Then a close cycle of friends and colleagues at work, they should form some support group, just like the way we are now advocating for the fact that we should have units of HSE or safety in all organizations. The same thing with this, support groups. Involvement in social activities also, such as in sports, and such also will now be able to, help in, supporting people. In conclusion, we should understand these few things. Your mental health is in your hands, just like it is with many other things. You should know that you should get a way of trying to learn and know how your brain works, how optimally it can work, and how you can help in making it better, and also managing some of the mental problems. So let us watch out for our emotional well-being, as well as that of everyone we interact with at home, in the neighborhood, and also in work or at work. Let us also cultivate the habit of being there for each other, thus promoting our mental health and reducing the tendencies towards suicide behaviors. I was able to get, some helplines. In Nigeria, I have a friend in the University of Ibadan who is a psychiatrist too. We are members of a kind of some organizations together. So when we're talking about there are some helplines that you can get. So if you are feeling suicidal problems or know someone who is, then please call these suicide prevention lines, which they are there. You can now see in the screen. So lastly, I would like to acknowledge that my friend that I told you, Dr. Jibril Abdul Malik, who is in the Department of Psychiatry, University College Hospital, Ibadan, University of Ibadan, Nigeria. I also like to thank International Brain Research Organization that has taught me a lot. I have been a member of International Brain Research Organization, and then most of the things I do as a professor of neuroscience, they have impacted a lot, and they have spent a lot on so many workshops here, abroad, and many other countries. Almost all, more than 20 to 30 countries have been supported by International Brain Research Organization. And also, I would like to thank the Student Representative Council of ABU that made me to make these slides to be ready that time in 2019 in order to make it possible for us to start to see, because I did not think that that problem of suicide, was something to be discussing, but it was when they prompted me with that was when I came to realize that a lot of statistics has shown to me that such problems exist. And then since then, I have started and I've been canvassing for a way of helping into that. So thank you very much for listening, and I welcome questions and comments from you. Thank you.
Thank you very much, Prof.
Right, my IPP. Hello, my IPP, can you hear us? I think she's having issue with her network. All right, thank you very much, Prof. Such a very insightful presentation. At this point, we will ask questions. Does anybody have questions to ask? Prof is very, very capable to respond to them. Any question, please? Let me also check the chat box. Okay, there are no questions on the chat box. Please, if we have any question, we can just unmute and go ahead and ask our question, please. Professor Jude, do you want to ask something? I can see your, okay, go ahead, please.
Yes, I want to begin by thanking Professor Rabi for this exposition, breaking it down in such a way that we can follow and understanding the dangers associated with suicidal tendencies and what we can do. My comment is on the awareness, which he actually emphasized. But I think that looking at the Nigerian society, we have so much we need to do in terms of awareness. The typical African person, Nigeria in particular, do not have value for therapy or going to see therapists. When people have problems and issues, the first point of call may be their parents or their pastors, who most times are not professional help givers, who will be able to guide them properly in ways that they'll be able to resolve the issues that they are having. And I've seen many cases where people have, behavioral problems, emotional problems, suicidal tendencies, and because of the places they've gone to and who they spoke to before then, sometimes they want to make them believe that some of these things are as a result of inherited curses, demonic manipulations, and they end up taking them to churches for deliverance, and they should pray for them and all of that. I'm a religious person, but I think that sometimes we ascribe too much to our religious background and upbringing to the extent that we neglect, the psychological makeup of people and the help that is available for them. I am the director of my university's student help center. We do a lot of orientation for students that if they have issues, they should come to the center. And even last year, I proposed to the university, that at the point of registration, before they are giving matriculation number, students should come to the center to register with us so that we have their studies and their details. They come to register. But soon after that, you don't find them anymore. When they have issues, they don't come. Then from nowhere, you hear that the student committed suicide, a student did this, a student do that. So there's a huge problem with the African culture, recognizing the value of therapy, that there are people who are trained, who are help givers. So I think that, with this beautiful presentation, that ASSP need to do more in terms of awareness creation. That should be your concern. Like Prof suggested, maybe make handbills, little posters that should be distributed around the whole place to create that awareness. If the awareness is well created and people know, then they will come for help. If they come for help, then of course they will also be able to prevent and avoid suicidal tendency or actually committing the suicide itself. Now, Prof, I want to ask you a question.
All right, sir, go ahead.
Yes. For non-professionals, maybe parents or peer group, people who live in the immediate environment of those who have suicidal tendencies, what steps can they follow to help them in order for them to be able to, if they already have the tendency, one, then how can they be helped to prevent it? See, some of them may not even know the value of therapy or where to go to for therapy, or even want to access therapy itself. Because ESSP, many of them, they are not in the helping profession as such, in quote. But whatever we are giving to them now equips them, to be able to help. Now, if they go out with the handbills, what are those things that non-professionals be able to do to assist with preventing suicidal occurrences or preventing suicidal tendencies? So, Prof, once I want to say thank you so much for this exposition. It was quite beneficial and helpful. Thank you.
All right. Good. All right. Hello, the secretary, sir.
Yeah, you can go ahead. Yeah, you can respond to the question. I don't know if is there any other question? So maybe you just take two of them. Does anybody else have any question to ask, Prof? So we can just take them all together.
Good evening, all. My name is Cam. Mine is not a question. Slide, he had showed some helpline. Please, could he put back the helpline? Suicide helpline.
All right, secretary.
I'm doing that right away.
All right.
Confirm, can you see?
Yes, that's the line.
Okay. All right.
Yes, and I think since I think the slides will be shared, so that will also help. I think maybe the secretary, I think the members of the group, later maybe you can share the slides. That will also be of help. Yes.
Sure, we'll share the slides on the group, and also just to let us know that this training is live on YouTube, so you can always go back to our page on YouTube to listen to it over and over again.
All right, that's very good. All right, so maybe before we forget, let me respond to what Prof has asked and also has talked. Yes, thank you very much, Prof, for bringing such and also corroborating with me and adding, a kind of voice on the fact that awareness is one of the most important things. And I'm also very happy, sir, that what you're doing in your university. One of the problems is the fact that I'm happy that your university has already even recognized the fact that they should have you to share something, But in many institutions, they don't have such, because as I've said before, most of us do not realize the fact that there are so many problems that affect our students or our wards at family level that are either problems that might go into depression, which might end up with suicide, or the case may be. And this one happens even in high places. It's just like the way that we know that sometimes even medical people like us, normally people have this problem of not even checking themselves. I know of many of my colleagues that have died of stroke, where they have sudden elevated high blood pressure. And the reason is because you now see somebody every day with the stethoscope and everything, taking the blood pressure of people, but the person has not been, checking the blood pressure of himself or herself, which at the end of the day, it causes a lot of problems. We also have some people training people on the fact that you need to get a way of understanding how your brain works. You need to sleep well. As an adult, you need to have at least 8 hours of sleep, this and that. But such people do not sleep well. So at the end of the day, there are such problems. So awareness is seriously a key. On the other side, sir, what you have asked is that that's why I broke such things into, the support at different levels. We talk of individual levels. We talk of the family level. We talk of whatever. First of all those levels can only be good or can only work if all of them interact with each other. What I mean in here is that if at individual level, I do not take care of myself to understand some suicide tendencies because I lack awareness of what suicide or of what depression can lead to. I hope you get me. Then at the end of the day, then If you are not whatever, you might not understand. Let me even tell you, some of us that understand the suicide or the depression itself might be depressed, and they know that. Like, for instance, with all humility, I share my my experiences. There was a time, due to some reasons, one or the other, I was depressed for some time. So I was telling myself that I teach depression, I treat depression, I talk about depression, but look at me being depressed. So, but at the end of the day, I was telling myself that, look, this is something important, that let me move. And they normally say, practice what you preach. Meaning that, let me tell myself that it is not all over. Let me tell myself that nothing is much more than myself. I hope you get me. So I think awareness, and also continuous awareness, is one of the things that will make people to realize what depression that can lead to suicide will be. So it is when you get this that you garnish it together with this, what we call family support, work support. As you have said, it is when family understand the problems or the magnanimity of depression that they can get a way of trying to, let's quickly run to a person that will solve the problem for us. So meaning they will do their own. Because remember, if you get to a psychiatric, a psychologist, or whatever it is, there are some problems that they cannot do for you. For instance, Prof, you cannot say, if you have somebody with the suicide tendencies, that you tell them to bring the person into your house for you to be with the person 24 hours. It's not. That one is family support. I hope you get me. Good. So it means that mass awareness will make us to understand that how do we get to realize that, all right, these are some problems that can lead to suicide. Two, how can us as family members help in bringing what we call family support? So I think it boils down to the same thing as saying awareness and awareness and awareness. Thank you very much.
Thank you.
Thank you very much, Prof. Quite apt. Thank you so much. We can't take out that awareness out of it. It's actually the core of actually passing the message and making us out. Hello, can you hear me?
Yeah.
Hello, President.
Hello.
Yeah.
I have a question too.
Okay, you have a question, please. Okay, please, can we just make it snap, because this program is targeted for 1 hour. I will want to close at exactly 10 o'clock. So please, can we just make it quick?
Okay, let me quickly. Hello, can you hear me?
Yes, I can hear you. We'll go ahead, President. All right, I think President is having a glitch there with his network. So thank you very much once again.
Yeah. Okay. Good evening, everyone. Thank you, Prof, for this wonderful presentation. My question here is just with regard to, as you have mentioned earlier, that you never realize situations like this will come off to Nigeria or something like that. It's like we share the same feelings. When I watched recently that there was some suicide around Lagos by the beach and all those one, I begin to realize something that we normally watch in the movie or something now come to reality in our life. And it's something that has to be done to foretell the problems that emanating all the time. So my question here is, how do we arrest it earlier? That is beginning from our tertiary education and also our schools, primary school, secondary school, so that we impact something to them whereby it will begin as early as possible. How can we just enact some laws or something that make it presentation to our education, because I know you have some other means of communicating, so whereby it will be in our curriculum. How can we just make something like that so that we'll begin to champion something like that? Stakeholders from various association organizations in Nigeria. That's my question.
All right, thank you. Quickly, Mr. President, because of time, let me quickly just, respond to this. As we are all aware, I'm very happy that this group that is ASP and NITCOM, something like that, is something that came up that, why can't we get a way of trying to give support to the people that came back from Ukraine or something like that? So now I think this group is very good, Mr. President, you talk about. I think what we should be doing is let's use this as a medium to make sure that we advance for a kind of inclusion of mental health or something that has to do with that in our institutions, by interfacing with Ministry of Education. I think ASP can get a way of putting us together at the end of the day so that we can now meet up with ministries like Ministries of Education, Disaster Management, and many of them so that they can understand this, so that at the end of the day, we can now have a package that can be presented to the National Assembly. Let there be groups and whatever in schools, at workplaces, so that the mass awareness can go on and on, so that at least this problem can be arrested. I think let me just give it that way so that maybe because of time, but I think that can be done. And that awareness that I have said must continue so much so that family members will understand how they can do or what they can do to arrest this by understanding it early, by also trying to help and also seeking for professional advice and so on. Thank you.
Thank you very much, Prof, for that response. Thank you. So at this point, I don't know. I am IPP. Are you back? Can you? The floor is yours.
Yeah, thank you.
I can still see one more hand. I don't know if you want to take that because we run out of time.
No, the person can drop the question while we move on. So sorry, apologies. I have the network itch. Thank you very much for answering the questions. I think we'll hand over to the president to present the certificate. I don't know if he's ready. Secretary, is he ready? Can you share?
It is. Just a minute. Let me share the certificate. It is ready.
President, over to you, sir.
Okay. Welcome, my IPP. Sorry for the network issue. Okay, Secretary, the certificate there on the screen.
Yeah. Can you see it? Confirm you can see it.
Yes.
Okay. All right. Okay. Yeah. On behalf of SSP Nigerian chapter, I'm here to present the certificate of recognition. It is a tradition for SSP that whenever we have a guest speaker, we honor him with the token, his certificate. Prof. Rabiu Abdusalam, for volunteering in SSP Nigerian chapter as a speaker on the suicide, the problem of today's youth and the setback to national development, solution and the way forward. We hereby present this certificate to you, and we really appreciate your presentation. You did a wonderful day for us, and we appreciate. Thank you, and God bless.
Thank you very much, President, for that activity. Thank you. Then our president to say, we appreciate you, sir, and we look forward to hearing more from you whenever we call you next. Thanks for also volunteering to be part of us as well. I call on Dr. Okando, our president-elect, to round up the section for us. Dr. Okando, sir.
Thank you, my IPP. Prof,
Thank you, sir.
I am not surprised. I learned that professor is coming. I said, do I really need to say thank you, Prof? Because I know what you can do.
Thank you very much.
You have just done justice to the topic, even though the time wasn't enough, but your time management was quite cloudable. I appreciate you for this, and I say thank you and more kudos to you. Just like my IVP said and my president said, we know more is coming from you, and we'll see have some laws to learn from you, and then we go out there to the field and practice what you have taught us. It's not about sitting here learning from you, but it's about how do we now transfer what we have learned to practice. And I believe that we are going to do justice to this with time, having the IPP ahead of us. Thank you so much. And to all of us that participated, thank you all for making out the time to listen to this. And I know you must have jotted one or two things. Please, let's keep things and let's keep on and let's work together and achieve our goal. Thank you.
Thank you very much, Doc. We appreciate you. Yes, back to Cynthia Obiora. Let's quickly say, I will also want to contribute that on every level, we try and observe the behavioral change. It can point to persons having suicidal symptoms. Okay, thank you very much for your input, Mrs. Obiora. We appreciate you all. On this note, we end today's section, and then we'll bring forth the next section where we'll be having our next speaker speaking to us. Please, if you have any contributions or anything you feel we can learn from, you could drop it on the platform before our next section. And if you have also any questions you want us to direct to either our first
My IPP. Hello.
Thank you.
I think we lost her. Hello. Yeah, I think we lost our IPP.
Yeah, IPP. Yeah. But I think
the network has been so bad.
Yes, sir. Mr. President, sir. Hello, sir.
Bro.
Yes, I want to make an appeal, please. Hello.
Well then.
Yes, I said that first of all, I would like to say that thank you for that certificate of recognition, and I'm very happy to have it. And I would like to say that even though whatever that, perhaps if President-elect, can you also hear me?
I can hear you loud and clear.
Yes, sir. Please try to just maybe as this has been presented, if you can also try to tell the people for the conference to also prepare the same certificate on the of this presentation that I have made. I think that will also be good in that line. Yes, thank you very much.
Can I ask a question? Can I ask a question?
Yes, sir. Go ahead, sir.
Yeah, I would have suggested.
All right, quite noted.
Okay,
Madam Refo, if this meeting can be brought backwards, this 9 o'clock is a bit late for me, and I don't know what others.
Yes, yes.
If it can be like 8 to 9, I think it's more better than 9 to 10.
Okay, Mr. Dixon.
Sorry, what happened was we make so many consideration for the meeting. Sorry about that. Earlier than this time, if not because for our Muslim faithful is Ramadan, and normally that 8 o'clock is mostly the time they engage themselves into other prayers and activities. So that's why we look over the time and slated 9, which is ideal for everyone within this period. But look upon next time after maybe Ramadan or anything. Yeah.
Oh, okay.
Sorry about that.
No, I remember now because of Ramadan. Yeah.
Yeah. Thank you. All right. I think on this note.
Yeah. Yes. I was just about to tell you I think we've lost IPP, and she was just about doing the closing remarks. So I think on this note, I think we just have to draw the curtain so that we can allow people to go and catch their bill. Yeah. Thanks.
Thank you, everyone. Bye for now.
Bye.
Bye.